Good afternoon and thank you, Chair. Present is Dr. Dlomo, Ms. Geller, Dr. Jacobs, Ms. Ishmael, Ms. Shirwa, Dr. Tembekwayo, Mr. Van Staden. I've received an apology from Mr. Munyai. He is not well. Ms. Seke is attending another meeting and will join later. The minister requests to be excused at 3:15. Thank you, Chair.
Okay. The other members that you did not say anything about maybe are going to be logging in anytime?
I think so.
No. Okay. Mr. Khatla, may I check if the minister is logged in? I see you here on my screen. Oh, there's Ms. Kwahube. Ms. Kwahube is also present. Mr. Khatla, do we have, I see Dr. Manzi is also logged in. Maybe the minister is speaking from that platform.
Yes, good afternoon, Chair, and good afternoon, members. The DGs are on the platform already. Chair, I'll just check with the PA of the minister quickly. Thank you.
Okay, sometimes you like to make opening remarks before you start the presentation. That's fine. Honorable members, we received the presentation 2 days ago, and I'm also preparing the DG or Dr. Anpan, I don't know who's going to be presenting, that so that we can engage much longer. We may not need to get every slide detailed. But however, because the media has joined in, we will also request that they are not too fast for just to highlight and then summarize maybe 15 and not more than 20 minutes so that the members can then engage, especially that the minister would like to be released at 3:15. So that part we agreed on. Thanks.
Chairperson, may I ask something? Will you allow me that I ask something, please?
Yes.
Now, in light of what you just said, that we have indeed received this report 2 days ago, isn't it? Will it be more effective? That we go straight over to the questions instead of a department presenting something we have already read in this past 2 days, and we can, due to the time constraints which the minister have, we can go straight over to our questions, and so that minister can be able to answer all the questions which has been raised.
Yeah, we can do that. It's fine if there's a wide support on that. I just thought maybe the media might just want to, of course, I'll give the minister to make opening remarks, but we had thought of that, but I'm just thinking now if the media is joined in, they will probably want to see those slides, but not all of them, I don't know. Yes, it is meant for us and the media is also part of this meeting. Maybe let's take a combination of both. Let's have not more than 15 minutes, minister together with the DG, summarizing what they are saying to us, which we already say we had 2 days ago. Just that 15 minutes, Honorable Van Staden, might still be important to give the content. Then we then start with our questions. I hope we will be able to have a second round of questions on this matter. Just a combination of both, get a bit of an information from them, and then we start. We don't go slide by slide as we had indicated.
That's exactly my concern, Chairperson, is if a presentation is too long, the minister can't answer all our questions, and then we won't have a bite for a second round. That's why I was proposing.
Okay. I think that we will adhere to that. Thank you very much. I saw, okay, another hand, that hand has gone down. Yes, Mr. Khatla? Okay, we'll just wait a bit, honorable members. Yes, Joe? Mr. Khatla, you want to say something?
We're still waiting for the minister to log in, Honorable Chair.
In light of what we are saying, maybe we can do a combination of both. I was going to say something when the minister comes through, but maybe I see now Anpan has
logged in, Chair.
Honorable Chairperson, I have logged in. I'm sorry about the delay, but I am in.
Something happened here. Oh, the minister is logged in. Thank you very much. When the minister logged in, I logged out. So he's responsible for my being logged out. I'm joking, Minister. Honorable Minister, we would want to remember this week as your vaccine week, as a minister's birthday. It was a day and you brought us vaccines. We will congratulate you on that part. Number two, we have just been listening to Advocate Motibi talking about something that should not have happened in our country, the scandal on PPE. Honorable Minister, we are hoping that with the leadership you have, you'll do everything that we don't have Advocate Motibi in the near future talking about the scandal on the vaccine procurement. You'll do everything humanly possible to do that. Thirdly, Honorable Minister, we are grateful to your department. We received this presentation 2 days ago, and therefore we have actually agreed as this portfolio committee that we would want to give you space to talk about it, and we will not go to slide by slide presentation because we have already had it for 2 days. Instead, members will then fill the questions based on what they've read, and then the minister will assist us in that understanding, bearing in mind that the minister is going to be with us until about 3:15, of which I think we will officially make that meeting come to an end at that time. So with those opening comments, Honorable Minister, I now give it to you. And we would wish you to go and make your opening remarks, and then I will then ask members to start sending their requests to me to field questions to the minister. Honorable Minister, we give you now space to speak.
Thank you very much, Honorable Chairperson, honorable members. Let me start by saying thank you to all of you that I did get lots of messages from honorable members, and some members sent me flowers and all sorts of nice messages. I must really say that it was quite touching, and I want to say thank you very much for that. And I think for us all, the Monday was also a particularly exciting day when we received the first consignment of our vaccines. We have all indicated that with this pandemic, one of the major forms of prevention is the provision of vaccines to be able to create immunity amongst our people so that they can on their own be resistant to this very viral infection that is quite virulent in some instances, causing loss of life as well as severe illness, hospitalization, and a huge pressure on our resources and health services. I accept your approach, and I'm going to try and keep it short, so about not more than 10 minutes, just to walk through the issues. But just to say as well, I think this approach is very helpful because then we can focus on the questions from the members. The approach that we are taking here, I want to assure the members here that it's a very difficult terrain to manage the issue of vaccines because of the fact that the global demand is same for every country throughout the whole world, and therefore everything is happening at the same time for every country, and so that really creates its own dynamics. Nevertheless, I still believe that as South Africa, we are on course. We have not lost time in the context of the fact that we will be starting our vaccination soon. We did say that we will be having these vaccines for the next 10 or 14 days, and then once that is cleared, we should then be able to proceed with the vaccination program. I think we must also recall that part of the things, the issues that have to be balanced has been the fact that not all the vaccines have had all their results out, and therefore we have to tread carefully in the area of how we approach the management of the vaccines, so that everything must be all aligned by the time we actually get to the vaccination. And as we move on, there are obviously lots of moving parts in this whole issue. But nevertheless, we still are committed to vaccinating up to about 40 million people in South Africa. That process, we'll do everything to ensure that they are vaccinated. We are aware, though, that there may well be challenges of the global supply, and the countries that have paid for vaccination for 3, 4, 5, 6, 7 times their population needs, they are also struggling because of the blockages or bottlenecks in the vaccine production process. So we've even seen, the whole huge amount of resource nationalism, where in the US and in Europe, there have been calls now, in some instances, enforcement that there can't be any exportation of vaccines unless the local populations have had their needs already fulfilled. And so it's a worrying issue there. We have set up the structure, and the structure at this point it starts now with for the cabinet. President has set up an interministerial committee led by the Deputy President with a number of committees, and you will have seen that in the slides, that those committees are those that will have something to do with the process of rolling out the vaccine. Then linked to that are also other structures. In the area of governance, we've got the DG setting up a structure which is involving both the private sector, the labor and civil society to work together in coordinating our response in terms of taking this vaccine to the different levels of our people. That most of on the current vaccines, we're storing them at BioVac, but in the rest of the country, we've identified centers where we can have the vaccine stored under the requisite cold chain conditions, so that they can be well kept for preservation. There will be obviously very good security at that level. Now all the provinces have produced the plans and they are ready to move to start vaccinating. In the course of all of that, we have a number of health workers trained. We've also engaged a number of health stakeholders now, religious leaders, traditional leaders, civil society, and so on, to actually explain to them the role that we wish them to play in this whole process. So ours is to then make sure that we continue to get the support from the Ministerial Advisory Committee in terms of what other steps and any new information that needs to be taken into account as we move along. We must say that it's not going to be a smooth process. We must expect that there will be mistakes, there will be stop-starts issues, there will be issues of new lessons, there will be issues of challenges, obstacles. All of that will be taken in our stride as we move on. We wouldn't really, if there's a problem, start saying that, look, this plan is not working. We will actually be saying, we found a new challenge, we're going to resolve it and move on until we've actually successfully vaccinated everyone. We've seen that in some of the countries, simple issues such as the breakages of vehicles and issues of freezers, breaking down and so on, can be serious problems. And so we are aware that it will be it won't be a smooth issue. We will still maintain that the phases, we want to get the health workers out first, and that covers everyone who comes, who deals with sick people, and that is whether it's hospitals, universities, research bodies, traditional healers, clinics and everyone, those will be the ones we're going to focus on. We have launched the electronic vaccination data system, which will register the health workers. I don't know today, but by the time we did the launch, at the end of the day, we had gone to about 68,000 people. So it means the uptake is quite good. And so at this point, we're of the view that from the health workers' point of view, there's a huge expectation that these should be, the vaccines will have a good uptake. Then the second phase are all those who are in the front line. That goes from teachers, police, all those who are servicing communities, they should be in the front, and then of course those with comorbidities. That gives us close to about 16.5 million people, and then that phase should, the first phase should take us about 3 months, the second phase should take us about 6 months, and then the last phase should take us 3 or more months, depending on what the situation and the supply would be at that point. However, we do anticipate that if we find that we are able to secure adequate vaccine before the end of 3 months, we'll start the second phase nevertheless and open up our logistical processes to move on. We have indicated that we have engaged a number of platforms and manufacturers to get the vaccines, and we've indicated that the 1.5 that's come from India, the Serum Institute, that has been paid for. And then we've got agreements now which we are finalizing, waiting for the final agreements with the specific dates, delivery dates and amounts per batch and so on. That should be coming in the next week. But nevertheless, on our terms of agreement, originally we have got the 9 million that is secured from Johnson & Johnson, and another 20 million that's secured from the Pfizer, and then there's also another 12 million that we should expect from COVAX facility, and all of that together we will ensure that we will have at least no less than 26 million people's vaccines already assured. But the other vaccines, we've actually laid our hands onto where we'll get them from, and we will not announce it until we've got some kind of agreement with those that are part of it. So if you look at your document, although it talks about what could be a shortfall, what in reality it means is that those are the ones where we've not put agreements in place yet. So, but it's not like that we don't have any a sense of options as to where we're going to be getting them from, and negotiations are going on at that level. Then we are also in touch with a few others. We have already have a contact with the China, Sinovac and Sinopharm. They've been very, very supportive as well. They wanted to offer as well to collaborate with us, and our scientists are working together with them. We've also worked together with we've met with the Gamaleya Institute, the Sputnik V, which has just come out as well as having very good efficacy as well, and our teams are working with all of them. So with any concrete plans going forward, we will discuss with them. We're Moderna, we're also engaged with them. So literally on the main ones, we are actually engaging continuously, but where we haven't got anything signed, we will not say too much about what we're negotiating with them. And so without wasting too much of your time, I think it's important to say that, as I've said, that our system, we have a number of research laboratories, some from agriculture, some from medical researchers, who have got a capacity to store up to -70 degrees. But we've also been seeing that the number of private sector are interested in offering these services. So that work is going to be done. We will put up an open bid for those. It should have come out maybe today or tomorrow, just for the future, because this current one with BioVac managing it, we don't need much of contracts with it, but we're going to be looking at that. So in this context, therefore, we are on course, as we've indicated, that the current vaccine have gone for testing in the quality control laboratory, and then of course they'll be back in the next few days. So every province has got its own areas where it's going to be able to store, and we are actually moving. We've got a whole map, as you will see on your slides. It's showing everywhere where there will be distribution. It tells us we can go right as far down as district hospitals to clinics where there is need. And there is a lot of coordination also going on in the private sector. We're working very well with the private sector. As we said, that government, for the purposes of the national vaccination campaign, government is procuring and is also supplying both the public and the private sector side, and there's good cooperation there. There's also a lot of support from the private sector in the form of Business for South Africa. And of course, yesterday we're at the NETLEC. There's a lot of support to come in with additional expertise to help government where we need support, particularly on the logistics and the administrative infrastructure. So there's an open what called work streams that are working on that particular issue. We also have got in the interministerial committee a focus on the capacity for South Africa to manufacture own vaccines, and we're moving in that particular direction. A number of countries that have indicated support to work with us in improving that capacity, and so all of that is part of the work that we are busy with at this point. So with all of that, I think that the main issue that we have to focus on is limitation of the risks. At this point, on the procurement side, we think that the risk is much less because it's going to be Treasury and National Health Department that are going to be procuring. They are aware, for example, that there are a number of offers for vaccines, but what we have done is that if it doesn't come from the original manufacturer, we've actually asked them to come forward and show us what they are offering, and then we will then first validate them and make sure that their authenticity is beyond question, and that the quality of the vaccine cannot be in doubt, and then we can start looking at all of that. So all of that is on course. The area where we think there may obviously be contractual issues that need to be given attention so that we can prevent fraud and corruption is in the area of logistics, deliveries. In that area, we will have to be very tight as we work with them. We have already met with the Auditor General, who has given us ideas in terms of which way we need to be looking at. There's also a lot of interest from some of the bodies, such as Corruption Watch, who have already started asking to follow up what's happening and getting information and so on. We're determined to make sure that the process is as transparent as can be, and that at the end of the day, we don't want to really be bogged down by a problem of corruption. We want to make sure that our focus is on what lessons we get out of this process, and we have a successful vaccination campaign. So we have therefore a whole risk assessment analysis program that the Interministerial Committee is focusing on, and we've actually brought in the Fusion unit, the unit of the investigators that are involved in from the different arms of government, that they will actually work in very closely with us to come in as soon as there is suspicion or reports of any malfeasance, so that we put that one out of the way. We also have to look at the issues of theft on the ground. We believe that because the vaccines are going to be free to the recipient, and that government and medical aids are going to be paying for it, particularly the administration costs. So there shouldn't be anyone who must therefore be paying to get a vaccine. And if there is anyone who has to now start having if there's anybody who's going to be paying for vaccine, we need to really question that quite carefully as to what is happening there. But from where we sit, if there is no payment for the vaccine, then it limits the market, the black market involvement in this whole case. Those are some of the issues, and of course, your own observations would be of interest to us. We'll try and create a balanced system of procurement to make sure that there are opportunities both for people who are capable of rendering the service in this area, and that we offer opportunities for SMMEs, and as long as anyone who comes in will actually be able to meet the standards of what we are looking for, then we can deal with it. So the rest of the issues around the security of vaccine is going to be taken care of as a matter of major focus. And we also hope that the members would also give us some of their ideas of what needs to be done. Let me just say, for example, the one issue that's a very interesting debate that's going on around is a question as to at which point do we bring in all these leaders here, the members of parliament, Should they get injections first, or should we wait for the people to come in? Others, I saw a paper written by some fellows in the UK who were saying, no, everyone must wait their turn based on the vulnerability index and so on. But I think there are lots of myths and disinformation. It may well be useful to make sure that to boost confidence, some of the leaders must also move in front, just to make sure people don't feel that the leaders are also afraid of taking the vaccine themselves. And so we'll have to balance that one up. Chairperson, honorable members, let me hold it at that, and then we'll be ready to pick up the questions as we go along. Thank you very much.
Thank you, Honorable Minister. Since your last update, we have just been receiving provincial leaders to come and update us as to their readiness to take the vaccines from you. And we will on Wednesday be getting province number 6. We already have had a presentation from Western Cape, Eastern Cape, KwaZulu-Natal, Gauteng, and Limpopo. So on Wednesday, we'll be having Northern Cape. These ones that are coming in much later have a better plan, stronger than those that came much earlier. So it does indicate that this is a work in progress. I've been informed by some of your members in the department that the presentation was updated, but then I said, look, maybe those new slides will be incorporated into explanation further as we take the questions and we don't go on it one by one. The following members have indicated their interest and the desire to engage with the minister. Please, honorable members, let us also make sure we ask, but make room. First one is Honorable Ismail, followed by Honorable Imam Sheikh. Number 3, Honorable Van Staden. Number 4, Honorable Wilson. 5, Honorable Chirwa. 6, Honorable Kwahobe. 7, Honorable Dr. Tembekwayo. And 8, Honorable Dr. Jacobs. Those are the ones that have forwarded so far to me, and I'm noting them. If honorable members say, oh, and then there's another one that has just come in now, number 9, Honorable Sokacha. If you can then come one after the other, giving you those numbers that I think you are keeping. Let's start with Honorable Ismail. Thank you very much.
Good afternoon, and thank you for the presentation. Good afternoon, Chair. Minister, please advise why vaccines were procured so late. We expect to experience a third variant in June or July. How are we going to reach herd immunity by that time? It is really sad to think that we could be losing so much more lives because of government delays in procuring these vaccines. What is the total amount paid for all the types of vaccines currently? And have South Africans from all walks of life been included in the vaccine trial program? Please, can you specify on what basis were vaccine suppliers chosen? What was the deciding factors? Was it prices? Was it availability? How effective are the vaccines procured against the COVID-19 variants in this country? Please, can you provide us with a full report on donors of these vaccines, if there were any donors? Minister, many South Africans are, very skeptical about these vaccines. How sure are we as a country that, these vaccines are really indeed safe for South African citizens? South Africa has ordered vaccines from the Serum Institute of India. Now, we know that this is a private company and nothing to do with the Indian government. We are essentially purchasing vaccines at double the price as compared to other African countries. Were there no other options available? I know you've stated that, the government is in discussion with other countries. But at this particular time when these vaccines were procured, I'm thinking that we should have been thinking about this already last year. Why couldn't we source these vaccines from Aspen directly? And at this stage where we are with the COVID-19 variant, where we are right now in the country, how far is our country preparing to, develop our own vaccines? Minister, now that SAPRA has agreed for the controlled use of ivermectin, where will South Africa source ivermectin from? I see you haven't touched on this on your presentation, but if you don't mind, if you could answer us. Will there be a GMP set for ivermectin? I mean, will there be a single exit price set? And will you consider setting an exit price so that we don't have an influx of pricing now that ivermectin will be, available in a controlled manner? Minister, are all vaccine sites adequately equipped for cold storage and backup generators in case of power outages and load shedding, which we know is very well known in our country? We have had some provinces coming out to tell us, but I mean, we haven't heard from all provinces as yet, so we would like to hear from you. The SMMEs that qualify, you have touched on it, but what are the requirements to qualify? Minister, please advise.
Honorable Ismail, you are on question number 15, and there's other 8 members.
I only have 15. Chair, are there any clinical trials on ivermectin in the country presently? And Minister, there's been some noise on social media that some vaccines are not safe for senior citizens, and there were some queries of the impact of vaccines on people living with HIV and AIDS. Please advise on how you are dealing with this. Thank you.
Honorable members, we might have a second round. Please be considerate. To get 12 questions from one member at a go is not accommodative of other members to also have to ask questions. Please let us considerate of other members. Honorable.
Thank you very much, Chairperson. Can you hear me?
Yes, sir, we can hear you.
Thank you, and Minister, thank you very much for your short presentation. Let me start off by saying, Minister, that I would have absolutely no problem as a leader in the community to be able to take this vaccine if this is going to give some level of confidence to our people on the ground. But let me start off by asking you the first question. Minister, do you not think it is important that before these matters are brought in the media, in the public domain, that the Portfolio Committee on Health, which is responsible for oversight, should be briefed so that when we get questions from the public and the media, we are able to respond accordingly? More often than not, statements are being made, press releases are being made, but members of the Portfolio Committee know very little or nothing about what is happening. That's the first thing. The second thing is could you tell me, Minister, how is it that your department orders these and entered into procurement contracts with various suppliers? Whilst I don't have a problem with it, because we ought to be in a hurry to secure these vaccines, there is no authorization or application by SEPRA, who said to us the other day that they are responsible to authorize these things before any orders are placed. And no authorization was provided to them when any of these things, currently even with all the vaccines that are coming, other than the one that has just arrived, there is no authorization from SEPRA, who ought to be the regulator responsible for authorizing them. Now, the other thing is this, some of the vaccines have an efficacy rate which is quite high, 95%. Could you explain what is the rationale behind purchasing from companies like Aspen or Johnson & Johnson, which has a much lower success? Could you please explain that to me? The other thing is this, that whilst you're giving us a plan, provinces are still asking the question or raising concerns about the funding that might or might not be available. Like the Western the other day, they're looking for 1.7 billion, and they don't know where they're going to get this money from to be able to, in a satisfactory manner or in an effective manner, roll out these vaccines. So we're concerned about that. Now, the other thing is this, what appears to be, some kind of confidential agreement the national government has entered into with these providers. My understanding is this, that these companies that are providing these vaccines are not going to be liable should anything go wrong, because remember, this is a brand spanking new vaccine. Couple of months, we don't really know what the effects, and we hope and pray that it is really going to be effective and are not ever exceeded. Now, what is the position if should something go wrong in terms of who is going to indemnify people that are taking these vaccines? The other question is the issue of the tracking. And I see you've got a great system in place. Will that system include all those that have been taken the vaccine and over a period and have monitored for any such side effects and things like that? The other issue in terms of that I want to deal with is the issue particularly about ivermectin. Now, I remember you saying that, Minister, and your department saying that this is a sole responsibility of SEPRA. My understanding was that National Department of Health ought to have been in the forefront of accelerating any process to review any data that's available anywhere in the world. And SEPRA says that it is the Minister of Health who was not happy about it. In the meantime, the National Department said it was SEPRA's responsibility. Now that SEPRA has given us some guidance on the processes that need to follow, Minister, it's not giving us a clear indication, because some of the experts and scientists are saying that you can use it as a preventative measure. SEPRA is saying that doctors must make an application, and I do agree that you don't need authorization, you must make the application. I think it is more to help SEPRA in checking on side effects and following it and looking at its success and whatever it is. However, how and what process will we make if people need to be able to take this particular ivermectin? Because it is also their right to be able to protect, and there is no side effects. There's no doubt for 30, 40 years, this is proven without any doubt in any case. So that they could also have that, but in a controlled environment rather than what is happening. And my other colleague had just wanted to know from you exactly which are these companies. And if we could take away the bureaucracy in terms of this, I think it will go a long way in being able to help us. The other thing is the vaccines. Is this now going to be an annual vaccine after we've exhausted giving it to everybody like we have the flu vaccine? Then lastly, the AstraZeneca vaccine that we have come, there is indication from some countries it cannot be rolled out for people that are over 60 years of age due to the risks. And I think some countries like Germany and things have now made it very clear that it will not be given to people over the age of 60. But very importantly, which we are not talking about, that some of these vaccines have proven to be fatal in some of the countries, although I think some research is being done to that effect. Like if you look in Norway, over 30 some odd people have died by taking the Pfizer vaccine, and I think it's under thorough investigation. So could you tell us, can we be convinced or satisfied, Minister, that indeed there's nothing really to worry about in the country? Take the vaccine, it's the right thing to do, so that we too can have confidence as public representatives and go out and tell our people with no doubt whatsoever that yes, this is the right thing in fact to do. Now you're talking about SMMEs, Minister, and I agree with that. My problem is this is about to be rolled out in the next day or two. When are we engaging with this process? Thank you very much.
Honorable Imam Sheikh, you said last, and then you start another question on SME.
Yeah, it comes up, Chair, all the time. There's so many we have. 2 hours is not enough, Chairperson, to engage with the Department of Health. It's just not enough. With due respect, let us be honest.
We are guided by the availability of the Minister because he has also other pressures to handle in the country. Honorable Van Staden.
Thank you, Honourable Chairperson. First of all, I want to say happy birthday to the Honourable Minister. I forgot to send him a message this week, but yet is happy birthday, Honourable Minister. Honourable Minister, will be there enough and sufficient trained healthcare workers to do the vaccinations, and can a report be provided to us of the amount of healthcare workers per province that will indeed do these vaccinations? In your presentation, you mentioned a shortfall, and you just talk about it, of vaccines of around 38 million doses. Can you just explain to us again, how is this going to impact on your plan to vaccinate the 40 million people by the end of the year? I mean, already you are running behind with the 1.5 million vaccines that South Africa already received Monday from India. With this 1.5 million doses, you can only vaccinate 750,000 people. So I think we need more clarity on that. What assurances can you give South Africans today that there will not be any corruption in the tender processes, in the distribution and administration of the vaccines, And I'm glad to hear that you say it will be an open tender process. Let's hope it will stay that way. How will government monitor citizens that is not able to register via the app due to the fact that most South Africans do not have internet access or the necessary tools to access the internet? In October 2020, only 1 million citizens accessed the COVID app out of 60 million people. I think that's a matter of concern. Is it safe to import a lot of different products of the vaccine? Is it safe for one person to probably receive 2 different shots of the vaccines? And if not, what plans do government have in place to see to it that a patient indeed receives 2 shots of vaccines that is from the same product? And then some scientists say the vaccine will be successful and others say it will not be. What are your views as the Minister of Health on this matter? How do we know, or what guarantee is there that the vaccines will indeed work? If the vaccines is not effective against the COVID virus, will you as a minister approach SAPRA to approve ivermectin for human use and to legalize it to treat COVID-19 patients outside of Section 21? And will you classify it, for example, as a Schedule 4 prescription-only medicine or a Schedule 8 as a controlled drug medicine? I have asked you last month, and I'm asking you again, Honourable Minister, will you be able to reach your target to vaccinate 40 million people by the end of the year? I'm asking this in the light of the different dates communicated by this government, the President and yourself, on when the country will receive what type of vaccines. I remember on the 7th of February, you said in this committee that 316,000 vaccines will have to be administered every day of a week to ensure that at the end of the year, a total of 40 million people will have been vaccinated. Now, that target is already missed with 29 days. Today already is the 5th of February. So will you be able to reach your target to vaccinate 40 million people by the end of this year? Can the Minister also give us a timeline? Where will the vaccination program start across the different provinces? Because of the reports we have received from provinces this far, not all of them are very good. And will it all start on the same day across the country? Or how exactly will this program be rolled out? Another question is, what precautions and security measures are being put in place to ensure that the vaccines do not get stolen? And will the transport and distribution of the vaccines across the country be safeguarded? And how will you do that? And if you can't tell it on this forum, that's understandable, but then we need a report. As